minutes, maybe 5-8 minutes at the most in this presentation, this YouTube. And we want to talk to you about two things that are unrelated, but are things that sometimes emerge in your practice and in your work. So I'm going to talk first about the counseling note as it relates to group work. So what do you do for that? And then I'm going to turn the floor over, and Nicole, who's had just a plethora of experience working in situations where the topic of mandated reporting arises, and she's going to talk to you about that for a few minutes. So let's just delve right in. So Nicole, you have the slide up with my group note, correct?
Yes. Mm-hmm.
All right. So this is not original to me. This was something that I learned in a practice where I was working, where we were using groups as a primary way of doing treatment. And so, what happens if you have 4, 5, 8 people in a therapy group or a psychoeducation group, and you get to the end of your session, and now you're staring at a stack of charts, 8 people, for example, in a therapy group. Are you going to write 8 separate notes? Well, that is a very intensive kind of thing to do. So what I learned to do, and I've always thought that it made sense, and I've never had any pushback from people when I ask them about confidentiality or HIPAA compliance, because individuals usually, to participate in a group, have signed some form already that says that they're understanding that they're in a group and that there are risks and benefits to groups, and things like around confidentiality. So what I have always done is use this note that you have up here in front of you. And so to the left of these yellow, or what color boxes are they on yours? Are they
green?
Green. The green boxes on your slide are just the different individuals and how they have positioned themselves in the room. And so MF just stands for Mike Friendly, and I don't know what ZK is. And so these are all just initials, people's names. And so rather than writing their names, I just use their initials, their first name initial and their last name initial. And I like to chart this because people will sit in different positions from week to week, or they'll sit in the same position. And sometimes how people are arranging themselves in groups makes a difference. And so this is my way of just capturing kind of the setting and where people are putting themselves in the group room. And then I usually write out to the right of that just the theme of the group. So this is, maybe I'll write psychoeducation group for parenting stress. With a child with an oppositional defiant diagnosis, whatever. I also then put the date and time. So what time of the day did this take place, and how long did it last, and what was the date? And so I've captured a lot of information right there. And then I usually then jump down to where the lines are, and that's my note section. And so I'll typically write. You could use a SOAP note for this. I would typically expand a little bit about the theme of the group and what I saw emerging amongst the group as a whole. So maybe a few sentences to say that everybody was actively engaged and participating at different levels of the group. And then I'll spend probably the bottom 2/3, and I'll just write down at the beginning of a line MF, and I'll write down what this individual's particular participation was and what they did in the group. Maybe a couple sentences, and then I'll go to KL, and I'll go to LP and OI. These don't really look like people's initials, but that's what I meant when I typed them. And so now I have one note that represents everything that went on in the group. And rather than me having to write 8 different notes or 7 different notes or how many group members there is, I can now just photocopy this note, and I've referred to everybody by their initial. Instead of their name, and I can just photocopy it and quickly insert them into the clinical chart. Or I guess I could, in an electronic chart, I could just do a cut and paste kind of thing. So that's it for me. Nicole, have you ever seen anything like this in groups, or what have you?
I have, yes. I didn't have the diagram, which I like that to indicate where people are sitting, but I have been taught to do group notes that way as well, with one and then kind of identify who did what, and after a nice summary. So
yeah.
Yep.
Good. Okay, so that's my thing. If you find yourself in a group situation and have to do a clinical note, I would suggest something like this to help you be efficient, and capture everything that's gone on. All right, your turn.
All right, great. As Dr. Newmeyer said, we thought it would be a good idea, since I have some of this extensive experience with mandated reporting, to just give a few important pointers that I have learned over time. The first thing I learned, and I learned this the hard way, is that it's very important to notify the family first when possible. My experience has been that families typically are receptive to that. They understand that you're a mandated reporter, and it's long term is better for your therapeutic relationship, because typically they're going to know it was you anyway, depending on I mean, the families are they can put it together. So my very first time reporting, my supervisor and I was real nervous about it, and I had done an in-home session and called right after, and we had decided I wouldn't tell the family. And of course, Children's Services immediately responded, and so my client was furious with me. And it made sense to me. I damaged the therapeutic relationship. If I had just talked with her about it before, I think we could have continued to work productively. And so, yes, definitely notify the family first. I've even worked with families on doing a voluntary referral. And Children's Services, everyone has a very negative view, but really they offer a lot of supportive services. And if you can explain and educate families about what's available to them in working with Children's Services, it can really actually be a beneficial experience for them. Different states obviously have different level of resources, and same with different counties. And so you would, I guess, want to be kind of familiar with what your state and your county offers. But
when you say voluntary, you're so like, if you're working with a family or a system and you find out that maybe a parent is being physically abusive with a child, to see if you can empower that parent to make that phone call to Children's Services rather than you being the one that initiates it. Mm-hmm. Is that what you're talking about in that instance?
Actually, I was talking more about in situations of neglect, or where families are really struggling to provide, or there are concerns about a family's ability to provide. If it's the physical abuse is on the line, in terms of, like, if it's a clear cut, then we would have to. But yeah, so it would be more if the family isn't necessarily going to qualify based on it being a mandated situation, but you think that they could benefit, and they do offer if the county or state offers voluntary services, which they do in Ohio, then they can get that support, additional support.
So I have had these situations where I've realized that the parents were crossing the line, and this was something as a mandated reporter I had to call in. And I've said to the parents, look, I'm a mandated reporter, and explain that. And I said, but you know what? So here's the way this is going to go down. I'm either going to call or you're going to call. If you call and say, it really looks more like you're asking for help. Mm-hmm. And this becomes a win-win situation for you. Whereas if I'm the person that has to report and you're resistant to this process, this is not going to go well for you. And so there's some therapeutic leverage that I've tried to empower the individuals to make those phone calls with me in their office. Mm-hmm. And then it seems to kind of be a kind of how I've been able to massage it. It doesn't always go that way, but I've done that a few times for sure, and it's worked.
Yes, yeah, it's a very good way to explain it, and yeah, that would be very appropriate too, for sure. I think if you can take the negative stigma away from Children's Services as you're working with the family, it helps a lot, even in their interactions with Children's Services. So I also think it's important, that you do gather the details that you need for reporting. Over time, you kind of learn what types of things Children's Services needs, and you may, details such as who's living in the home and their names, and it's a lot of details that you aren't necessarily thinking about. You're wanting to gather the information about, the incident or what occurred. But over time, you kind of learn the other details that they are asking for typically, and makes your report stronger, and it makes it a little bit easier for them to do their job. And so along those lines, I highly suggest seeking out any trainings that may be offered from Children's Services in your area. I had the opportunity to attend a 3-hour, and it was an ethics training as well, which I needed. But I learned so much. It was actually put on by Children's Services, and they talked about what they are looking for and what information to have when you call, and they explained their process in detail, and it was so helpful for me to understand that from their perspective, because they are the ones that are fielding these calls all day long, and have to make tough decisions about whether to investigate or not investigate. And so it was very beneficial. So if you can seek that out, I would highly recommend it if it's available to you. And then also I would say, remember, it's not your job to investigate. It's your job to report suspicions. If you have suspicions, certainly you want to ask the important follow-up questions to just make the determination as you're assessing if this is something you need to report. But it isn't your job to solve the case. It's your job to report it to the people who are trained in making the determinations. And what I have learned over time is that I never know what Children's Services is going to do with what I call in about cases I thought, oh, they're definitely getting involved. They don't even investigate. And other ones where I think I'm just calling this in, I'm wasting everyone's time, and then they show up and take the child right there, and you're like, what? Yeah. So you never know. And so it's important to report. That's my point. And then make sure you're documenting thoroughly. We talked in class about using quotes. I definitely use quotes when I'm reporting to Children's Services, especially if it's from the child themselves, and what they're disclosing. And then you need to adjust the treatment plan. If you're working with a family and you learn of abuse or things that have been going on, that needs to become part of your treatment plan in working with this family. That is all I have, actually. If you ever have any questions or concerns, definitely seek supervision or be happy to talk with anyone.
Yeah, I have one question, and I've been pretty successful at this tack. So a lot of times these cases feel on the fence to you that when you encounter them, like, is this a reportable offense or isn't this? And so you can seek supervision. But I've often had good luck at calling Children's Services and just saying, look, I'm a therapist, I'm a mandated reporter, I have a what if scenario. Mm-hmm. And can you answer, I have a client and here's what's been presented and here's some of the collateral information I have. Is this a reportable thing? Mm-hmm. And then they'll say, nope, that one's not reportable. And you document that conversation that you did that. Or they'll say, yep, that's a reportable one. You gotta give us more. And then it's game on, I guess. But sometimes I start with a kind of like a what if, and it kind of seems like I'm using them as my consult, right? So because they're the ultimate arbitrators on some of these things. Have you ever done that?
I have done that, and that's a great point. I'm glad that you brought that up. You absolutely can do that. And it's interesting to learn the different cultures of different agencies. I know in Ohio, in Franklin County where I was working, it's a very, very large county. And so their process, they actually have a streamlined process that is based on a research they've implemented a program that's based on research that they've been trialing. Whereas if you call, and so they have very specific questions and they want you to follow their flow. Whereas if I call like a small agency county where they have on-call worker, maybe 2 on-call workers for the whole county, they're a lot more, the process is more organic, and it's just a different experience. So, but you'll probably encounter that as well.
All right. Well, thank you for this. I hope, class, I hope these 2 topics are helpful to you in your clinical development and in this class. Thanks for hanging out with us.
Yep. Thank you.